Hi, my name is Robin B.
Okay.
And we're coming from the chatter. And thank you so much. And please excuse that little pause, I think, between our music. I was into the music and I was doing this and I forgot. So anyway, today's conversation is going to be about doctor. Why do we have to wait so long for doctor's appointments? I
Hmm.
mean, I had a doctor's appointment in January. I got stuck because of the weather and stuff. And I had to change my appointment from January 7th. They gave me an appointment in April. I mean, I could be dead by now, but
Yeah.
it's okay.
Yeah.
God forbid if anything was growing in me
Yeah.
or whatever.
Yeah.
Um, by the time I got there, it'd be like, oh, we need to treat you now.
Yeah.
You need
Wait, then you got to wait another 7 weeks to 7 months for them to do what they got to do. It's
exactly
crazy.
right.
It's
It's
crazy.
crazy, but there is a explanation. We all know it started from COVID. And a lot of
Yep.
times when it started from COVID, all of the doctors and nurses were burnt out. We know that from what
Yep.
had happened. But since then, though, because of that burnout, a lot of doctors have retired. And
Mm.
since that period of time, articles that we've investigated, um, big corporations are taking over. Big corporations are taking over private practices. When you used to go to your doctor and knew who you were talking to,
Mm.
they're taking CVS example, CVS Medical, what is it, Health
Yep.
Services, Amazon
Amazon.
Health Services, and other big corporations. And now these doctors have to go by a protocol that they're not used to, because you're used
Yeah.
to being able to talk to your doctor, blah, 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 this, that, and the other. And because they have these new rules and
Middleman.
regulations,
Mm.
um, that's why it's messed up. And it's giving them a lot of frustration. It's giving them a lot of anxiety. And they
Hmm.
are also going out because of stress and stuff
Yep.
and have lowered their hours.
Yep.
Now it's only a 15-minute window for most people. If you notice, like I go to one of my doctors, he's good though. I mean, I still have to wait a long time, but
Hmm.
he has you ask questions and that's a good thing and stuff like that. But he's 15 minutes.
Yeah.
When your appointment is at 12:30, you guarantee to get in there by 12:35.
Okay.
He's following, but that's not always good because you have other questions. Everybody's situation is totally different, you know.
Right.
Because what if you go in there with a long thing that you've been waiting all this time, and now you have an ailment that is just not something that you're getting a review on.
Right.
It's something that needs to be addressed, or you
Because
want
your
to be
appointment was for an original ailment, and before you got to see the doctor, this new one creeps up. Yeah.
right, exactly. And even with him, the same thing. I had to cancel his appointment. They gave me March, right? From
Mhm.
January, they gave me March. Then, like 3 days later, they sent me a message stating, you can't come on March, but you're on the
Wow.
waiting list.
Wow. And that's the other thing, the waiting list. When you call a doctor and they're like, "Oh, well, if something opens up, we'll let you know."
So by the time you call them back, they tell you it's gone.
Yeah.
Or
Yeah.
something like that. But yeah, it has a lot to do because we ought to all assume that a lot of, well, not all of us, but a lot of us, me, assume that the waiting list is so long because of COVID and it's still going on and but it's more than that. It's the corporations too that are being taken over and the different protocols that they have to follow versus the hospital protocol. The hospitals are also being bought by some of these big
Corporations.
establishments.
Yeah. Yeah. It's
Exactly.
it's it's the middleman between you and your doctor. It's these medical corporations and the insurance companies. You know,
Right.
the health
Right.
insurance companies and the the insurance the doctors have to take out, the medical insurance they got to take out as well. You
Mm.
know, I mean,
Oh
it's
yeah, and the lawsuits too.
Yep,
Yeah, all of the malpractice suits they're
malpractice.
trying to cut down. So and they have to deal with that and this. It's just a mess right now, and they don't have. They're trying to get, well, all the students. I'm gonna say, well, the article had said like 70% of the students that are graduating, 60 or 70% of the students that are graduating are going into private entities as far as testing medicine,
Research.
teaching medicine.
Yeah.
They're not treating clients. They're
Yeah.
not going into that field of medicine.
Because it's less stressful.
It's less stressful. So people are leaving, like we were talking about the bathtub scenario. People are like, your bathtub is full with physicians, but as they leave and as they drain, they're trying to refill with the faucet, but they're refilling, but half of them are not going into that part of the bathtub that you want them to go into. So
Yeah.
now it's still being depleted because they don't have the percentage of doctors that are actually treating patients.
Yeah, because they also want specialties too.
Right. And that's where most people are
school.
going, into those specialty fields.
I could go to medical school and be a plastic surgeon, make big money as opposed to being a general physician, primary physician, and have to deal with all that stress and things like that,
Right. And that's what
the other thing is, I think as long as we have to abide by the rules. I mean, if you have the money that you can pay the doctor straight out, and he doesn't have to deal with the insurance companies and the corporations or whatever. And there are doctors that are going that route. My doctor referred me to a pain specialist, and I went to make the appointment with the pain specialist to see if they accepted my insurance. And they said, we don't take anybody's insurance. You pay us straight out $75 for the visit, and I'm like, wow, but
everybody don't have that. That's the problem.
You got to keep going back. That adds up very quickly, and not, like you said, not everybody has that.
Not everybody has that. No, because I had to do that with my dentist. I had to pay straight out for my dentist. Everybody don't have that. Everybody don't have insurance, although I think now you're supposed to. I'm not really sure.
Yeah, that was the thing with Obamacare. It was supposed to be affordable coverage for everyone.
I know that wasn't affordable. I mean, that's what I've heard.
Well,
I have Obamacare, but
I've heard
people complain that. But I think Obamacare, I don't know. I'm not even going to talk about Obamacare because
the Affordable Care Act was so that everybody would have coverage. That was the premise of it.
And didn't it help people with like terminal diseases?
And pre-existing conditions, because previously the insurance company could deny you. You already had that before you went to this new physician, and it's like, we're not going to pay to treat that anymore, and it's like crazy,
Right.
So and that's the other thing with the doctors that are retiring and the doctors that are burning out. It's almost like, if you try and stay in network and you call your doctor, they're like, we're not accepting new patients,
Right. Yeah, I've gotten that. Yeah.
And it's like, or if you are a new patient, you're going to have to wait 7, 8, 9 months before you get to see the doctor.
And that's exactly what they said. And I have some bullet points here. We found some bullet points to help you guys. I don't know how it's going to help. I mean, I've tried. We've talked about the waiting list. But, they said, become friends with your nurse and doctors, not your nurse, become friends with your receptionist and nurse doctor's office. So when they do get cancellations, if you're on the waiting list, they'll contact you probably first. Another thing I noticed too, that this come from me, like say a day like today, or if it's very, very rainy, like it's like 0 degrees weather here, whoever's listening to this. But if it's rainy or something like that, if you know it's going to pour the next day, call the day before and ask whether they have any cancellations for tomorrow.
Yeah.
So make the initiative yourself.
Yeah.
Like I thought about doing that today, but I was like, nah, I'm not going out there in 0 degree weather either. But you can make the initiative yourself and continue to call your doctor's office. And if you do that, then they will know you that way, because if you have an appointment every 6 months, they're not going to know you. You know what I'm saying? Yeah. So you can call them by bugging them, because you know what they say, if you keep calling somebody, eventually they're going to get back to you. So when they have that next cancellation, he'll say, okay, this person kept calling me, so I'm gonna give it to them. And this is like for general
ailments. If you need emergency
ailments or checkup or something like that. And, schedule your appointment while you're there at the appointment. That helps, instead of waiting and calling for an appointment. You can always use the tele, what,
Telehealth, yeah. I've
telehealth.
done telehealth visits before.
Yeah, and let's see what we have. Another thing we were talking about is oh yeah, one more other point. Don't be shy to go to the ER or
Yeah, or Emergicare. But no,
or
with Emergicare, their hours are 8 to 5. So if you've been sitting there since 11 and it's 5 o'clock, they're gonna send you to the emergency room at 5.
where you have to wait another 2 hours.
Yeah, at least, you know. I mean, and that's kind of what they're trying to change medicine into, which is crazy. A 9 to 5 kind of ordeal, you know,
Yeah.
with evening hours 2 nights a week and on Saturday, you know, from 9 to 1 or what have you. And that's not how we are.
No,
We
because if you get sick, God
yeah,
forbid you should have even the simple thing as a cold. Well, now there's this new cold going out. It's not the flu,
yeah,
but it's
yeah,
really horrible and it is killing people.
yeah,
You know, and you want to say, oh, let me take some cold medicine, and then you just continue to feel worse and worse and worse. Then all of a sudden you want to go to urgent care and it closed.
yeah, yeah.
My drugstore is closed on the weekend.
Wow.
Yeah. And it's
Wow.
not, yeah, I'm not gonna name them, but it is closed on the weekend. It said we will be closed from Saturday and Sunday. Every weekend they're closed.
You know, it was
Right now,
funny.
I have to make I need prescriptions for my eyes. I have to make my get my prescription Friday
Hmm.
or Monday. No prescriptions
Wow.
are being offered on the weekends. None. Now the store's not closed, but the pharmacist is closed.
Wow.
That's crazy, right?
Yeah, yeah, and they're the other ones under the gun too, the pharmacists. I noticed I used to have a regular staff at my local pharmacy, and then they implemented the mandatory lunch hour. So
Yeah, we have
shut
that too.
down. They're
And you
shut
cannot pick
down.
up any prescriptions.
Then they started rotating. You know, I wouldn't see them all the time. I would go in and it would be a different crew, which, you know, I'm like, okay, I get that.
Yeah, yeah.
But they're all new people there now. I have never seen any of them, including the pharmacists, besides the pharmacy assistants and things like that. So
Are
I
they
don't know.
rotating stores or just they might be rotating stores? Because I noticed that my pharmacist is not the same one either.
Yeah.
It might
And,
be
you know,
rotating stores, so they don't get so familiar with the customers too. You know, they do that too, you know.
and that's wrong. That's wrong because that's customer service right there. The pharmacist knew previously, oh, she's on such and such without having to look at your record. He's like, because I always feel such and such for her, and here's a new prescription that's going to
My
interfere.
pharmacist just did that with my eyes.
You know,
Called me up. She said, "You know, this is not the same thing you've been using." I said, "Oh," and I ended up calling the doctor, and they just left. It was like one little thing that wasn't on this one that was on the other one, so I knew the cap was different, and she automatically knew that it wasn't the same.
wow,
And she
wow.
told me. She called me
Yeah,
up to the desk. Yeah.
yeah, and that's why you try and establish a routine with a professional, you know. But these corporate changes that are implemented, they're helping their bottom line, they're helping their money, but they're not helping our health, they're not helping our lifestyle, and that's not right. That's got to
No,
change.
it's not. It's not. No, it's not quality. And another bullet I wanted to point out too is that if you can, because everybody doesn't have a computer or can go online or know how to go online that way, is put most of your information on their web or their app,
Yeah,
their web.
on your yeah,
They request
fill it out beforehand before you get there.
exactly that way you have more time to ask questions and be able to interact with the doctor, you know,
Yeah,
versus trying to. That's a fly. And
okay,
I'm sorry.
that's okay.
You know how I am. So it's like 0 degrees. I mean, come on. But anyway, to be able to interact with your doctor. So
Yeah.
anyway, so that's what we have to offer from you. If you guys got any more suggestions or comments to let us know as far as how you handle your situation, please leave your comments and let us know. We will discuss it and let it out to other people as well. But those are some of the things that I try to do too. But I think a good thing is to call them
Yeah.
calling them. And those are for standing appointments. But if you have some kind of emergency, make sure you try to go to the emergency. Maybe that's a better idea. Go to emergency room first. Go to emergency room.
Yeah, but you can say they take it priority. They don't take it by the time
That's
you come
true.
in.
Because somebody who got shot or their head cut off was
Yeah.
going to be in front of you, or asthma, or whatever.
Their head cut off.
I did. Yeah, I know. I used the extreme. It's okay. Yeah, they might be going to the morgue, not the emergency room. But anyway, thank you for liking.
Head in my hand. Can you help me?
Sharing and subscribing. Please share and subscribe. Thank you so much. Any other kind of thing, please let us know so we can discuss it. Thank you for being with us. This is Robin saying bye from the chatter.
Take care. Bye-bye.